So let's turn to part two, and that is coming back to the question about the imperative of American leadership. Actually, it is no question. So I recently saw an email exchange where someone quipped that in Washington, D.C., there are no less than 8 dozen conversations going on right now about the future of the liberal democratic order. So we're going to start another one here today. Secretary Albright, what do you think about this sense, now years in the making, that the liberal democratic order formed in the wake of World War II is at risk? Is that order still relevant? What's the role of American leadership today?
I think the order is definitely still relevant, because I believe that we're all the same and people want to be living in societies where they can make their decisions and be respected for them. And I never like the fact that people say people in X country are not ready for democracy. Everybody is. It evolves in different ways. And
Ambassador Haley, you've been at the United Nations for 9 months now. The UN was formed in response to World War II, and its charter affirms human freedom and rule of law and aspires to progress and prosperity. Does the liberal democratic order have traction at the UN today, and how do you assert that?
What I tried to do at the United Nations was just give a strong voice to America. And I think the biggest surprise that I saw were the ambassadors there at the UN. They're not just figures that were sent. They each are the most trusted person that their president knew they could send, and they have their direct ear. So negotiations can actually happen at the UN. I can go and try and negotiate something, and they literally can get on the phone with their president, and we can start moving foreign policy. And so what I have found is the United Nations is the center of the universe for every other country. And so what my job is to show the American people why it matters to us.
The liberal order, I think, is actually a bit in trouble. And I think the principles are still extremely important. And so what was it? It was, we believed in an international economy that was not zero-sum game. Now, if you look at a couple of signature programs that President Bush launched and that President Obama either kept or extended, the President's Emergency Plan for AIDS Relief. Everybody says worldwide, we saved millions and millions and millions of lives. If you look at global health issues like women's cancers, we've saved lives. Malaria, we've saved lives. If you look at the Millennium Challenge, where we are actually saying to countries, you have got to be governing wisely, fighting corruption, investing in your people, or you will not get a grant from the United States of America. And oh, by the way, we'll take it away if you stop doing that, as we did with Nicaragua. That's something that could be affirmed tomorrow, because there's plenty of testimony about how it's worked. When we talk about democracy promotion, I prefer the word democracy support, because people think that when we say democracy support or democracy promotion, we mean Iraq and Afghanistan. Right? Now, I would never have gone to the President of the United States and said, you know, Mr. President, we ought to use American military power to bring democracy to Iraq. That wasn't the idea. We had a security issue, perhaps with not as good intelligence as we would like. Maybe it wasn't the security issue that we thought it was. We certainly had a security issue in Afghanistan, where those safe havens were being used to attack the United States, and after 9/11 we had to get rid of them. So we had security issues. Once we had overthrown those dictatorships, we then had to say, what are we going to leave behind? And we believed that we were better to try to help the Iraqis and the Afghans build stable democracies. And by the way, I would still rather be the Iraqi than Syrian today. Now, most of democracy support and promotion, though, isn't that complicated. It is helping women's groups to find their voice in Kuwait. It is helping people to do election support and monitoring, which NDI and IRI, the Republican side of it, do in places that are having elections and want to make sure that they're free and fair. It's supporting a free press. It's supporting civil society. I met a woman in Russia a few years ago when we were there, a woman who was of limited sight. And she recognized that the Soviet Union and Russia had a long history of just tossing disabled people on the streets because they didn't somehow exemplify the greatness of the country. She actually went to Vladimir Putin and said, we've got to be better than that. And USAID supported her little non-governmental organization doing support for disabled people in Russia. That's what we do. And I hope that as we think about what doesn't work, we really look at what does.
And, you know, I think that it's a perfect example if you look back at the Africa policy during the Bush administration. I'm going to Africa on Saturday, the president sending me, because we want to build it back up to what it was. It has fallen, and our African friends feel that. And so we look at PEPFAR, and we look at all of those programs where we went and helped them build up their economies and all those things. We want to get that back.
I'll start with introducing Roy is Chief Medical Officer for the Global Connected Care and Healthcare Informatics Group at Philips. He's a doctor who has only joined industry in the last couple years after a career running hospitals and doing an awful lot of innovative things in the healthcare industry, so to speak, about which he has impressively strong opinions, which I hope will be displayed on this panel. You've met Vijay, who I introduced before, really one of the great business leaders in American business, who has turned to his new job turning around 3D Systems and basically made it into a healthcare company, which is really exciting. Next, Oliver Shang leads the Health Technology Partnerships and Corporate Development team at Johnson & Johnson. So he's a Silicon Valley guy who has moved into healthcare. And finally, Agnes Binewaho, did I say that right? Oh, good. All right. Is Rwandan. She was formerly Minister of Health in Rwanda. Some of you have seen her at our program before. She was at our New York conference earlier this year. And she's currently Vice Chancellor of the University of Global Health Equity in Rwanda, which she may talk about a little bit. It's a university that really aims to help grow knowledge about how to transform medical systems and to build more practitioners who can use modern tools across the world, even in the poorest parts of the world, to really make the health changes that are absolutely necessary. And just to reiterate the theme of this discussion, it really is about how technology can advance global health. And at Techonomy, we consider that an absolutely urgent priority. In the description, we refer to the UN Sustainable Development Goals, which, as you'll hear, are very important to us. There are goals for 2030, and one of them, several of them pertain to health, but they're not easy to achieve because they're very ambitious, but we need ambitious goals to change the world. Full tech and what we can do with tech into the thought.
Yeah, so there's a lot. So first of all, while I agree that there is a surfeit of technologies we could use in the medically developing world now, we're not using most of them in the medically developed world. You know, we have a number of technologies that we're developing at Philips that that have places to land, and some, frankly, that don't have places to land yet because the incentives to use them aren't in place. And most of the world's healthcare spend is in the medically developed world. And we're wasting, about a fourth of what we spend. So about $8 trillion, by my calculations, about $1 trillion in the U.S., wasted about $1 trillion in the rest of the medically developed world. That $2 trillion could buy a lot of technology for the medically developing world. But the conundrum is, or sort of the irony here is that in order for us to free up those funds, to transfer them to the medically developing world, we have to use technology more effectively here. And, eliminate redundant care, eliminate unnecessary processes, democratize care so that individuals can do what they can do themselves without the need for a clinician or a big, shiny, hospital facility. There's not much pressure on healthcare providers. So I was in a meeting about a year ago with a couple of very senior health system leaders, one of whom ran the medical practice, and I was talking about leveraging technology to lower costs and transfer funds in the medically developed world and all this. I thought it sounded like a great theory. And at the end he goes, I guess I could write a book on the things I've heard that won't ever work in healthcare. And it's a little deflating. And I said, well, what do you mean? And he said, well, I can't get 50% of my patients to take their medication. At which time I said, do you know why? And there was a silence, just like you heard then. I mean, it was, obviously he didn't know why. And so if we had this philosophical shift around, at least in the medically developed world, that healthcare is a human right, fundamental human right, got to be delivered. If we also held the medically developed world to incentives based on outcomes, if you did those two things, you'd create an incentive for different behaviors, and worrying about why 50% don't take their medications. If I'm going to be paid on the basis of how this population looks a year from now, I'm going to find that out.
Okay, but just quickly, if we're talking globally, why are you focusing on the developed world? What do you think would happen then globally if we did that in the richer countries?
Well, again, I mean, most of the money is being spent here, and there's not much left over for the rest. So if you take those Sustainable Development Goals for the UN, so that it's number 3, right? Improve the health and well-being for all individuals at all ages everywhere. And the statistics I've seen is we need to move from about $171 billion of expenditure to about $357 billion of expenditure. We need to go from about $20 being spent to $58 per individual. Right now we're spending like 80 or 90 in the medically developed world and 5 everywhere else. And so we need to redistribute some of that. And I think, again, technology is a way for us to actually improve care in the medically developed world, lower the cost at the same time, as long as those philosophical incentives are aligned with the use of those technologies, and then transfer some of those funds to the medically developed world.
To where it is, but I think that there really needs to be a clarification on the budget situation with what happened.
I think you're going to see the following problem. If funding for the United Nations is cut and you go and try to work on reform, you are not going to be listened to because you don't have the leverage. You are not going to be listened to because you don't have the leverage. And I have to say this, I agree with you, I don't like democracy promotion. I think you can't impose democracy. That's an oxymoron. What you have to do is have a support system, and what I'm very proud of that NDI does is elections, but also support for the rule of law. Civil society, getting women into office over the world. And by the way, the National Democratic Institute and the Republican Institute was created by Ronald Reagan. And so the issue is, and nation building is not a 4-letter word. I think the bottom line is, it is in the really the advantage of the country that we're doing it, but it's better for America. Because we will, as you said, Connie, democracies don't fight each other. And I'm very proud of something we did, which was to create the community of democracies, which was to meet and share best practices and try to figure out how to support each other. So those are the kinds of tools that are out there.
When Ronald Reagan created the National Endowment for Democracy in 1983, he said, "I just decided that this nation, with its heritage of Yankee traders, ought to do a little selling of the principles of democracy. Only people who think democracy is for sale can love the National Endowment for Democracy, aka the NED. It funded Oliver North during the Iran-Contra scandal. It financed the people who deposed Haiti's President Aristide. It paid almost $1 million to groups that staged a violent coup against the democratically elected president of Venezuela. Hundreds of people were hurt. More than a dozen were killed. To understand how this can be called promoting democracy, you have to understand the purpose of the NED. One of its creators, Alan Weinstein, told the Washington Post, "A lot of what we do today was done covertly 25 years ago by the CIA." Ron Paul wrote, "What the NED does in foreign countries through its recipient organizations, the National Democratic Institute and the International Republican Institute, would be rightly illegal in the United States. The NED injects soft money into the domestic elections of foreign countries in favor of one party or the other. Imagine what a couple of $100,000 will do to assist a politician or political party in a relatively poor country abroad. It is particularly Orwellian to call U.S. manipulation of foreign elections promoting democracy. How would Americans feel if the Chinese arrived with millions of dollars to support certain candidates deemed friendly to China? Would this be viewed as a democratic development?" Organizations funded by the National Endowment for Democracy include Reporters Without Borders. As Diana Barahona and Jeb Sprague reported, it demonizes governments that the U.S. wanted to overthrow, such as Cuba, Venezuela, and Haiti, while downplaying the human rights abuses of allies such as Mexico and Colombia.